Hello and a very good evening, friends. So, today we are at session number 5, and we will talk about nutrition, environment, and the biomedical waste management. Of course, in this session, it is important for us to understand that many things have changed, especially when we are talking of nutrition. For nutrition, whenever we talk, there is a recommended dietary allowance, right, which is given by the ICMR. So, ICMR and the National Institute of Nutrition, which is located in Hyderabad, so they both have given us the new recommended dietary allowances for all the Indians in year 2020. So this is the new update, and you just have to follow these new RDA guidelines. So that's kind of important for you, and many times students just get confused. Okay, sir, why are we doing this? I had studied the nutritional requirement as this much. Why is it changed now? Is it changed? So please note that the ICMR thing has changed. Apart from that, environment, I think it's still the same. The biomedical waste guidelines is still the same. There's no major change in it. So it's still hanging on the same. Let us start with the first MCQ. And we are going to look at the MCQs. Today's session would be a relatively smaller session because it's not so much conceptual and not so many things which are changed right now. So let's start on the first question. Visible fat intake for a sedentary worker male is. So what do you think is your answer in this? Any guesses you would like to make? Visible fat intake for a sedentary worker male is 10 gram, 20 gram, 25 grams, 40 grams. So today's class will be more of factual. In case you have any doubt at any point, you are welcome to ask it, but mostly it will be all factual. So visible fat intake, beta, we are asking about the fat intake. So fat intake is important for your exam because this had changed very recently. For sedentary worker male, it is unfortunately it's not D. Some students are answering D. B, 25 or 10 grams. What do you want to say? It is 25 grams. Absolutely correct. Absolutely correct. So this is what was changed. The visible fat intake for a sedentary worker male or a female. For a male, the sedentary worker or a moderate worker or a heavy worker. So there could be three categories: sedentary worker, moderate or heavy. In case it is a male, this is 25, 30 and 40. So 25 grams per day for sedentary male, 30 grams for moderate male, and 40 grams for heavy male. In case it is a female, just you subtract around 5, so it will 20, 25 and 30 for the heavy worker female. So these are your best answers. Of course, the best answer over here is 25, which is the question. Apart from this, I would also like you to remember that the reference male and reference female, in those reference male and reference female, the height is now taken as 95th percentile for male and female. Earlier there was an absolute number. So this is also a new update for you. The BMI range is old, which is standard. So please note that the BMI for Asian population, it is 18.5 to 22.9. The reference male weight is 65, female is 55 kilograms. This is all also old, which was standard. There's no major change. One important major change is also with the dietary energy intakes. So you need to remember that for male and for female. For male sedentary it is 2100 and for female it is 1600. And then I think if you would have watched my lectures in Marrow or in nursing live applications, so wherever you might have joined my lectures somewhere. So in case you have seen the lecture in nutrition, I have told a trick. I'm repeating the trick again over here, that beta, you just have to remember that it is a male or it is a female. And then you have to remember that for sedentary worker, we are giving something around 2100 and around 1600. And then For moderate and for heavy, you just add some numbers. You add in females, you add 500, and then whatever number you get, you add another shot of 600. So 1600 plus 500 is 2100. 2100 plus 600 would be 2700. So you simply add 500 and 600. Simple. And for male, on the other hand, it's the same story. So you add over here 600 and then you add 700. So 2100 plus 600 would be 2700, and 27 plus 700 would be 3400. So I don't know. There's a small irritation in my throat, so my voice may not be sounding as usual, but these days. So anyways, there's a kind of soreness in my throat and difficulty in speaking, but all said and done, that's fine. I hope we shall continue. So absolutely correct, everyone. Let's move on to the next MCQ. Which of the following is the best indicator for protein quality? So for previous question, which is the best answer? Please note that the previous question, the best answer will be, because it is a sedentary worker male, it is a sedentary worker male, we'll mark 25 as the best answer. Next MCQ, which of the following is the best indicator for protein quality in food products? This should be a easy going MCQ for you. What do you think is the best answer for protein quality in food products? Is it net protein utilization, indispensable amino acid score, or is it digestible corrected amino acid score, or is it the protein energy ratio? So yeah, Nivetha, very nice, absolutely correct. And I think Dr. Tuber, it is C, digestible corrected coefficient corrected amino acid score. DIAAS, absolutely C, very absolutely correct. So C is the correct answer. Whenever the MCQ will ask you about the best indicator, so you have to mark the best indicator. Some students are answering A and B, so it's not something different. So protein energy ratio, indispensable amino acid score, net protein utilization. So many students have started answering C over here. So anyways, let's see what is the correct answer. Let's see which of the following is the correct answer. See, if you talk about the protein quality indicators or protein MCQs which you need to remember for your exam. First thing is that the requirement of protein, the RDA for protein per day has changed. This is again a 5-star MCQ for you. So you have to remember this is a 5-star MCQ for you. The requirement of protein per day for adults, it is not 1 grams per kilogram per day. It is not 65 now for males and 55 for females. It is 0.83. Please note that this has changed. It is a new update for you. This has changed and it is a new update for you. Okay. Next, what about the protein quality indicators? What about the protein quality indicators? One thing is very simple. You already know what is amino acid score. What do you think is amino acid score? No MCQ on this. You don't need to remember about this MCQ. It's simple, basic understanding. What do you think is amino acid score? Amino acid score is amount of amino acid which is there in a food product. Let us say this is the food product. So amount of amino acid in this food product divided by the total amino acid which was there in the egg protein, which is taken as the reference protein. So amino acid in food product divided by the amino acid, the same amino acid, whatever single you're talking of, lysine, you're talking of methionine, whatever amino acid you're talking of. So same amino acid in a reference protein. Which one is the reference protein? That is the egg protein is called as the reference protein. So this is what is amino acid score. Next in line, what do you mean by a NPU? NPU stands for the net protein utilization. NPU stands for net protein utilization. So if you talk about this net protein utilization, it has further two components. One, we call it as the digestibility coefficient, another is the biological value. So what do you think is the digestibility coefficient? That how much I can digest. It is the amino acid which is absorbed in the body. It is the amino acid which is absorbed by my body divided by the protein which was ingested. So how much I can digest is what is digestibility coefficient. I think this should make sense in your mind, in your brain, that how much you can digest, amount of amino acid absorbed divided by amount of amino acid or the proteins which are ingested. Next in line you have is the biological value, the BV, biological value. So it's a laboratory indicator. It is a very sensitive indicator, but it talks about the nitrogen which is retained for the body mass. It talks about the nitrogen retained for body mass divided by the amino acids which are absorbed. Okay, so how much absorbed is there in my body divided by how much is retained for the muscle mass, that is known as the biological value or the essence of that amino acid. So if you just combine the digestibility coefficient multiplied by the biological value, digestibility coefficient multiplied by biological value, that is what will give you the net protein utilization. That is what gives you the net protein utilization. So what is the formula? This is an important formula you cannot afford to forget in your exam. What do you mean by net protein utilization? Net protein utilization is given by this formula: amount of nitrogen which is retained for body mass divided by amount of protein which was ingested. Please note, I would like to highlight it over here, that it is the amount of nitrogen retained divided by the protein ingested. That's a very easy way to understand and remember net protein utilization. It is very commonly, most commonly used indicator. It is most commonly used indicator for protein quality assessment. In previous times, we used to take it as the best indicator. Please note, I'm saying it is the most commonly used indicator, but it is not the best indicator. When they ask you about the best indicator, you have something else. You've already learned about the net protein utilization. Net protein utilization, that is the biological value multiplied by the digestibility coefficient. Then you have another indicator, that is PDCAS, protein digestibility coefficient corrected amino acid score. Then you have DIAAS, digestible indispensable amino acid score. And then you have another, that is the protein energy ratio. You don't need to remember the formulas for PDCAS and DIAAS, but please note that one of the best indicators, please note that the best indicators is DIAAS. This is the most accurate indicator for protein quality. This is the most accurate indicator for protein quality, that is digestible indispensable amino acid score. What do you mean by the protein energy ratio? Simple question, simple answer. That protein energy ratio, it is the amount of energy, protein energy. It is the amount of energy from protein in food product divided by the total energy from food. So amount of protein, amount of energy that you get from the protein in the food divided by the total energy from the diet, from the food, that is called as the protein energy ratio. Please, just one MCQ on this. You don't need to bang your head anywhere. So protein energy ratio is maximum for which food product? Any idea? Protein energy ratio is maximum for fish. Protein energy ratio is maximum for fish. It has roughly around 70-80% protein energy ratio. So therefore we say that the protein energy ratio is highest for fish. So it's a simple question, simple answer. Which of the following is the best indicator for protein quality? Whenever they will ask you about the best indicator, you have to note that it is the digestible indispensable amino acid score. That is the option number B is the best answer you would like to mark over here. It is not C, it is not PDCAS, it is not net protein utilization, it is not protein energy ratio. The best answer would be indispensable amino acid score. Right, so absolutely correct, it was fish. Yeah, I didn't see the chart. Yeah, Ashma Azmi, then milk. Which of the following is incorrect? Let's move to the next MCQ. Which of the following is incorrect? So today you must be enjoying because there's no so many concepts that you're going to learn. Which of the following is incorrect? Human milk is high quality protein and amino acid. Milk is a good source of elemental iron. Milk is not a good source of vitamin C. Breast milk, mother's breast milk, is very low in calcium. Which of the following is incorrect? So that's a kind of googly question. It's a googly question. Which of the following is incorrect? What do you think you're going to mark? Human milk is high quality protein and amino acid. Milk is a good source. Milk is not good source. Mother's milk is very low in calcium. So what do you think is the best answer? What you would like to mark over here? So let's start from below. Mother's milk is very low in calcium. This is a correct statement. This is a true statement. Please note that the buffalo milk, and then you have the cow milk, then you have the human milk or the breast milk. If you talk about the buffalo milk, it has roughly approximately 200 milligrams of calcium per 100 ml of milk. So cow milk has roughly around 120. It's all approximate numbers. So these are all approximate numbers, please note. Human milk has only 20 grams of calcium, milligrams of calcium per 100 ml. So we always say that mother's milk is very low in calcium. That is a correct statement. So if you're comparing with others. Milk is not a good source of vitamin C. That is also a correct option. This is also a correct option. Please note that all over, if you talk about the milk, it's not a good source of vitamin C, but there could be a question that mother's milk. I would like to say that milk is not a good source of vitamin C. That is a true statement. Please also note that human milk, mother's milk, human milk or the mother's milk has highest vitamin C among all the milks. So among all other milk sources. So mother's milk has highest vitamin C among all other milk sources. That is also a correct statement. Next we go over to the next option, that is milk is a good source of elemental iron. Please note that this is unfortunately a false option. It is a false option. Milk is not a good source. It is a poor source. So milk is a poor source of elemental iron, but we also say that milk, mother's milk, if you talk about the breast milk or the mother's milk, that is an adequate source. That is an adequate source of iron for baby till 6 months of age. So please note that mother's milk has adequate iron. Why do we say that mother's milk has adequate iron? Because it has the highest bioavailability. The mother's milk has maximum bioavailability. Maximum bioavailability is for the breast milk. So just remember this. That's a very simple common MCQ. Next question, which of the following milk has higher protein quality? Whenever we want to say about the protein quality, it's always that the mother's milk has very high protein quality and high amino acids in terms of the quality. So it is always said that the breast milk has very high quality. It's about the quality. It is about the quality. Which amino acids are more in breast milk? So which amino acids are more in breast milk? You can write your answers alongside. Which amino acid is higher in breast milk? It is cysteine and taurine. So cysteine and taurine. So yeah, casein and whey proteins, these are more for the breast milk. So yes, casein and whey proteins, these are more. Casein is much higher in any type of milk compared to the whey protein. The amino acids which can be asked in your exam is, you need to remember about the cysteine and taurine. Cysteine and taurine are higher in breast milk. So absolutely correct. Which of the following is the incorrect answer over here? Milk is a poor source of elemental iron. It is not a good source of iron. So absolutely correct. Let's move over to the next MCQ. The midday meal scheme has been re-innovated as which of the following scheme? What do you want to say? So earlier you had a problem with the midday meal program. Now in midday meal scheme has been reinvented. It has been re-innovated to a newer program. What do you think is this program? Is it the Pradhan Mantri Prime Minister Bal Swasthya Yojana, Poshan scheme, C option midday meal program, D option integrated nutrition mission? So what do you want to say? Midday meal program scheme has been re-innovated as. So I think many of you have got it correct. It is the Poshan scheme. This is the correct answer. Please note that there was a program. There was earlier, a long time back, there was a program. So absolutely correct. Many of you have got it right. So Simran answering B, Naved and Kaleswaran, Murugan, Arvind. Yeah, all are correct. So it is option B, Poshan scheme. See, earlier there was a program that is called as the Midday Meal Program. It was launched in a single state, the state of Tamil Nadu, and then it was very beneficial, and we found that the students were getting a lot benefit, and they were enjoying these midday meal program. The nutrition level, the nutritional status of the children was improving, and everybody was happy. So this Tamil Nadu model, the midday meal program, was scaled up into the whole country and was scaled up under the Ministry of Education or the Ministry of Human Resource Development, and they called it as the Midday Meal Scheme. So Midday Meal Scheme was the central funding, whereas the Midday Meal Program was a state level program. So you just need to remember that Midday Meal Program is an old thing. It was a state level program. Midday Meal Scheme was bigger than the midday meal program, and this happened somewhere in 1970s. So somewhere in 1970s we had the launch of the midday meal scheme. Earlier it was only there in Tamil Nadu. Then slowly we found very good results, and we integrated the midday meal scheme. Based on the midday meal scheme, we also formulated the ICDS, Integrated Child Development Services. But now very recently in year 2021, so in year 2021, we have renamed the midday meal scheme program to the Pradhan Mantri Prime Minister Poshan Shakti Nirman. That is the Poshan program. Please note that this Poshan, there are two Poshans now. There are two controversies now, or there are two points of doubt over here. There is a Poshan scheme which is under the Ministry of Nutrition, Food Ministry, or the Ministry of Health and Family Welfare. So this is called as, there are many ministries. So many ministries have taken part in this. This is called as Pradhan Mantri Scheme for Holistic Nutrition. It is Holistic Nutrition. So this is one scheme. Then you also have a Poshan scheme launched by the Ministry of Education. So now this Ministry of Education has launched what is called as the Poshan Shakti Nirman. So just one point for you to remember, that the Poshan scheme is of having two names. One which is launched by the Ministry of Health and Family Welfare along with Food Ministry and along with other Agriculture Ministry. So many ministries have taken part in this, and this is called as the Holistic Nutrition Pradhan Mantri Prime Minister Holistic Nutrition Program. So that is another program. Then you have a Poshan Shakti Nirman. That is under Ministry of Education. This is also called as the Poshan scheme. So under the Poshan Shakti Nirman scheme, please note that it is nothing but the midday meal scheme program. Now in this, two MCQs can come. First is, what is the eligible beneficiaries? The eligible beneficiaries are from class 1 till class 8 plus the Bal Vatika, that is the preschool children. So all are included under this program. That is your question number 1. Question number 2, under this program we are giving to the children, under this Poshan scheme, Under the Poshan scheme or the Pradhan Mantri Shakti Nirman scheme, under the Shakti Nirman scheme, we are giving some calories which is different from the primary and upper primary children. So for primary it is around 450 calories, and for upper primary it is around 700 kilocals per day. Kilocals per day. So just need to remember that we are giving some calories, we are giving some protein and fats to the children. It is different for primary school children, upper primary school children. Next MCQ is, we have expanded the eligible beneficiaries. This is very important point for you to remember, that the expansion of beneficiaries is there. We now include the preschool going children, class 1 student till class 8 student. So they all are included under this program, that is the Poshan Shakti Nirman scheme. Right? So which is the best answer? Midday meal scheme has been re-innovated as the Poshan scheme. So I think I have clarified the controversy. Every day on social media I do get a question, what is the difference between a midday meal program and a midday meal scheme? So please note that the midday meal scheme was the national scheme, program was only a state level program. Let's move to the next MCQ. Endemic ascites is due to consumption of, what do you think is the best answer? So endemic ascites is due to consumption of argemone mustard oil, pyrrolizidine, panicum miliare, or sanguinarin. So endemic ascites is due to consumption of what? Which of the following is the culprit in endemic ascites? What do you think you're going to mark? Argemone, pyrrolizidine, panicum miliare, or sanguinarin? What do you think is the best answer? So yeah, I'm waiting for your answers. Endemic ascites is caused due to, absolutely correct. I think many of you are answering it correct. It's a very easy, simple MCQ. You have done it 1,000 times. So this is a table which is, you must have seen in all the lectures, in marrow application, in your nursing application, everywhere. I've shown this. There's an old item that I show, old PPT that I show every time. So you need to remember the disease, then you need to remember the toxin name, then you need to remember the food product, and then you need to remember the prevention modality. So if you talk about the neurolathyrism, it is caused by a toxin, that is boa toxin, beta oxalylminoalanine. The dal which is affected is the kesari dal, right? Endemic ascites and epidemic dropsy is where many students get confused. Please note that endemic ascites and epidemic dropsy, they are different from neurolathyrism. Neurolathyrism, please try to understand that neurolathyrism, a person will get neurolathyrism when they will consume a dal. Now the dal itself, it's a problem. Whereas in epidemic dropsy, or when you talk about endemic ascites, in both these situations, epidemic dropsy is caused by consumption of mustard oil, but it's not because of mustard oil, it is because of adulteration. It is because of adulteration in the mustard oil. And similarly for endemic ascites, it is there in millets or the panicum miliare, but it's not because of the millets, it's because of the adulteration in the millets, it's because of the adulteration in mustard oil. So try to understand that neurolathyrism, in very true sense, it is a food intoxication, whereas the endemic ascites and epidemic dropsy, these are examples of food adulteration. In very true sense, there is a difference between neurolathyrism and epidemic dropsy and endemic ascites. So just remember that endemic ascites is because of the millets, which is adulterated. Endemic ascites because of millets, which is adulterated by crotalaria seeds. Endemic ascites is because of millets, which are going to adulterate the crotalaria seeds. Epidemic dropsy is because of Argemone mexicana, which is a weed. Argemone mexicana, it's a weed which is going to adulterate the mustard oil. So Pranav, very nice, absolutely correct. There's a small mnemonic for us to remember. That is for the dropsy. That's how I have remembered. So I'll just share with everyone right now that it is a drop. Do you remember that mnemonic, Pranav, about the drop? So if you do, then very nice. That's the correct answer. Drop how I have remembered, beta, this is just for everybody to know. So how I have remembered is that I take epidemic dropsy. So I just remembered the word drop. Okay, drop. Drop means what? Drop means liquid. है ना? Drop means liquid. So I say liquid. Liquid means something which is watery. So the toxin for an epidemic dropsy, the toxin which is there is the name, which is kind of a watery name. It is sanguinarin. So what is the watery thing? It is marine. So neer, you can also remember it as neer, sanguinarin, or neer, or water, or marine. That's how I've just remembered. So toxin name is sanguinarin. And what are the clinical features? The clinical feature is water. The name is, disease name is dropsy. The toxin is also watery, and the clinical feature is also watery. There is water in your eyes, that is glaucoma. Water in the heart, that is congestive cardiac failure. Water in the legs, that is pedal edema. So you have water everywhere. So that's what, there's diarrhea also, water in the stools. So that's how you can remember this. And moreover, the food product is also a liquid, that is the oil, mustard oil. है ना? So it's easy to remember if you just remember this word, that is pulmonary edema also. So it's easy to remember just single word, that is liquid, or it is water. So just 2-3 points about the endemic ascites. MCQs, high yield MCQs, which you need to remember for your exam. These are like 2 to 3 star. Very frequently you get questions on this endemic ascites. The toxin you've already learned, it is pyrrolizidine. The food product you have already learned, it is the crotolaria seeds in adulteration in millets. These crotolaria seeds are also called as the junia seeds. The signs and symptoms, they are predominantly liver toxicity. So they cause ascites, abdominal pain, bloating. And how do you prevent it? It's because of the difference in the size. Can you see that these are the millets? So the smaller ones on this side is the millet. So the millets are there, and these are so big seeds. So if the seeds are there in the millets, and while crushing or grinding or making the flour from the millets, these seeds also get crushed, and that's the reason people might land up into endemic ascites. And we just do sieving or filtration. We just do filtration or sieving. That is just to filter out, right? So that's how we just take care of this endemic ascites. So it's a simple question, simple answer. Endemic ascites is due to consumption of what do you want to mark? Endemic ascites is due to consumption of pyrrolizidine. It is due to consumption of pyrrolizidine. So that's all. Okay. Let's move to the next MCQ. Under Anemia Mukta Bharat, the dose of elemental iron and folic acid for adolescent girl is. So now this question is talking about the folic acid, elemental iron for adolescent girl. What do you want to answer over here? Under Anemia Mukta Bharat, the dose of elemental iron and folic acid for adolescent girl is 100 milligrams of iron and 500 micrograms of folic acid daily, 60 milligrams iron, 500 micrograms folic acid daily, 60 milligram iron 500 on alternate days, and 6500 on weekly tablets. So what do you think you're going to mark over here? Which of the following is the correct answer for Anemia Mukta Bharat scheme for adolescent girls? For adolescent girls, it is about the adolescent girls. So yeah, many of you are answering it correct. Nizam Khan, Muhammad Isha, Vikram, Ashma, Tawassum, Simran, everybody is correct. Everybody is correct. So I don't think I need to bang my head on this slide again. You all know the answer. So for children who are below 5 years of age, we are giving them bi-weekly iron folic acid. What I'll do is I'll just write it down, because rather than just speaking over here, if you talk about the children from age of 6 months to 5 years, it is 20 milligram of iron, and folic acid is 100 micrograms, and it is given as bi-weekly syrup. If you talk about 5 to 10 years, 10 to 19 years, then you have the WRA females, and then you have the pregnant and lactating females. So 5 to 10 years, we are giving them 45 milligrams of elemental iron and 400 micrograms of folic acid. This is given as weekly. Then you have, everybody will get 60 milligrams of elemental iron and 500 micrograms of folic acid. To the 10 to 19, we are giving them weekly. To this age group, we are giving them weekly. And to pregnant lactating female, we are giving them daily. That's the only difference. So remaining everything is still the same. Also, one more point you would like to remember, that for pregnant lactating and WRA females, it is a red color tablet. The 10 to 19 year children, it is a blue color tablets. 5 to 10 year, these are pink color tablets, and 6 months to 5 years, it is a liquid formulation. So that's a simple question, simple answer for the iron folic acid. I think everybody of you 100% have answered it correctly, beta. It is 60 milligrams and 500 micrograms of iron folic acid on weekly pills, on weekly tablets. Let's move over to the next MCQ. Which of the following is not true for Rajiv Gandhi Shramnik Kalyan Yojana? Which of the following is not true for Rajiv Gandhi Shramnik Kalyan Yojana? So it's kind of a not so commonly asked MCQ, but still it can be asked. What do you think is the best answer? Which of the following is not true for Rajiv Gandhi Shramnik Kalyan Yojana? Eligible only if insured or contributed for more than 3 years. Eligible in case of retrenchment, permanent invalidity, or COVID-19. Includes unemployment allowance up to 50% for maximum up to 2 years. Has replaced the earlier Atal Bimat Vyakti Kalyan Yojana. What do you think is the best answer? Yeah, many of you are answering D over here. Absolutely correct. So which of the following is not true? You have to mark which is the false option. So if I just show you, please note that the guidelines have changed very recently. There is a change in the guideline. So for all the new guidelines, you can refer this single website. So you can refer this single website for the new COVID related guidelines, COVID related changes. I'm just going to talk to you about the changes right now. So anyways, you don't need to, I'm not saying that you go to the website and learn from there. You can learn over here only. But in case you want to know something more, or in case you get confused sometime, you can use this resource, what you see on the screen right now. It's updated on the website, the ESI website. So just type in esi.nic.in, you'll get through the website. If we talk about the Rajiv Gandhi Shramnik Kalyan Yojana, so the Rajiv Gandhi Shramnik Kalyan Yojana, it has 3 reasons. So it's basically just simple MCQs. You do not need to remember the whole story. Don't listen to don't see what don't read and learn everything. Just see what I am going to highlight. So first MCQ it is that it is unemployment allowance. First MCQ, it is an allowance for unemployment. So to avail this allowance, you have to be insured for 3 or more years. That is the eligibility criteria. To be insured for 3 or more years. Next is, in what cases, under what scenarios can we get the unemployment allowance? We can get in case of closure of the factory, in case of retrenchment, that is, we just lay off the employees because of any reason, or there is permanent invalidity of the employee, or there is permanent disability to the person. So retrenchment means layoff, and this layoff is now includes COVID-19 cases. So it includes COVID-19 pandemic layoffs. So when there was work from home, or in case there was person had to be laid off, they were like not their services were not required by the organization anymore. In those cases also you can avail the ESI bonus or the unemployment allowance. This unemployment allowance, so there were two MCQs till now you have done. One was regarding the eligibility. Second, what is this Shramnik Kalyan? Third, so under this allowance, question number 3, what is the benefit? The benefit which is given is equal to 50% of the wage. This is maximum for a period up till 2 years. That's all. It also includes healthcare by the ESI in hospitals. It also includes vocational trainings and upgradation of the skills and so on. But very important for you to remember is allowance is 50% of the age of the wage maximum up till 2 years. So just 3 MCQs you need to remember. What is Shramnik Kalyan? What are the benefits and what are the eligibility criteria? 3 things. Next is there is another scheme. It is not, this option is the wrong answer. Has a replaced. It is not a replacement. This is wrong. This is false. It is not a replacement. This is a different scheme. So Atal Bimit Vyakti Kalyan Yojana, it is 2 different schemes. So you have the ESI. ESI has the Rajiv Gandhi Shramnik Kalyan Yojana and the ABVKY, the Atal Bimit Vyakti Kalyan Yojana. So these are 2 different schemes. It is not the same scheme. So under this Atal Bimit Vyakti Kalyan, again you do not need to read the whole passage. I have just taken this as a write up from the website directly. Just know the MCQs. So under this Atal Bimit Vyakti Kalyan Yojana, under this Atal Bimit Vyakti Kalyan Yojana, first MCQ, it is what? It is also unemployment. It is also unemployment allowance. Second MCQ, what is the benefit? The benefit is only up till, mind it, only up till 90 days and only once in a lifetime. That is the crux of the story. So this scheme was launched long back in year 2018, then updated and updated. So basically under COVID guidelines, for COVID-19 unemployment related, COVID-19 related unemployment, so all the people are getting the Atal Bimit Vyakti Kalyan Yojana benefits. So this is only for 90 days. Just remember this, it's only given for 90 days. It's only given once in lifetime. So earlier it was given, next MCQ, earlier it was given as 25% of the wage. But because of COVID-19, this has been increased to 50% of the wage. It has been increased to 50% of the wage. So just note that earlier it was for 25, now it has been increased to 50%, and it is only for 90 days, and all the COVID-19 related unemployments which have been generated, they are all covered under this Atal Bimit Vyakti Kalyan Yojana. Just remember these 2 MCQs. So one MCQ is about the 90 days. Second MCQ is it's been decided to enhance the rate of unemployment relief from scheme from 50 wages to earlier rate of 25. So only 2 MCQs in this whole paragraph. You don't need to do anything else. Okay, let's move over to, so what's the best answer over here? So what do you think is the best answer? Which of the following is not true for Rajiv Gandhi Shramnik Kalyan Yojana? It is eligible only if insured has contributed for more than 3 years. This is true option. It is correct. Eligible in case of retrenchment, permanent invalidity or COVID-19. Yes, this is also correct. Includes unemployment allowance up to 50% for a maximum of 2 years. This is also correct. So please note, has replaced the earlier Bimit Vyakti Kalyan. No, that's not correct. It's not correct. These are 2 different schemes which are functioning together. Next, latex gloves after use for dressing in HIV patients are discarded in. So we switch over to the biomedical waste management guidelines. Latex gloves after use for dressing in HIV patients are discarded in. Any doubts if you have, you can please write in the chat box. There's no problem. So I'll keep on answering all your doubts in time to time. Latex gloves after use for dressing in HIV patients are discarded in yellow bag, red bag, white bag, black bag. What do you think is the best answer? Gloves after use for dressing of HIV patient are discarded in B. Vikram, Simran, Nivetha, Raja, Deepan, Medico. So everybody going with B option. Latex gloves after use for dressing in HIV patients are discarded in. Pranav says B. Muhammad Isha. Absolutely correct. So many of you are going with the option for the red category. Absolutely correct. Please note that anything which is infectious and which can be incinerated will go into the yellow category. Anything which is rubber, plastic, tubes, so you can remember it as a repeat. RPT, you can remember it as a repeat. That means you are going to reuse, recycle the things. So these are, R stands for rubber, P stands for plastic, and T stands for tubes. So anything which is rubber, plastic, tubes, that is a repeat which can be reused or recycled, will be going into the red category. Okay, and it is not incinerated. It is not incinerated. Common sense, right? What will you discard in a white bag? In a white bag, we are going to discard anything which is sharp. Any metals, they are going to go in the white bag. What will go in the black bag? In the black bag, anything which is not a biomedical waste. It could be a solid municipal waste. It could be a solid municipal waste which goes into the black bag. What will go into the blue bin? What will go into the blue category? In the blue category, it is all broken glass. Please note, it is all broken glass plus ortho implants. So Ashima says, sir, but it is infected now. Yes, beta. Red category may contain anything which could be infectious. It could be non-infectious also. So, but if it is anything which is infectious or which is non-infectious, irrespective, it could be infectious, non-infectious. But if the entity, if the thing is a rubber, if it is a plastic, if it is a tube, it will go into the red category. If it is not rubber, plastic, tube, it will go into the yellow category. Are we getting this simple guidelines? So if you just look at this chart right now, anyways, look at this chart. If you see this chart, this is everything is for the red category. In the red category, you are going to discard whatever I'm saying. These are all important things. So you are going to discard in the red category. We will discard Foley's catheter, Euro bags, IV bottles. This was the MCQ. IV bottles and drip sets. Any types of heavy duty rubber gloves, surgical gloves, nitrile gloves, latex gloves, which includes the rubber. It's a type of rubber only, latex and nitriles. So nitrile gloves or the latex gloves. So everything will go into the red category. Syringes which are without needle. This has been so many times asked in your exam. Every day on social media I get question. Syringes without needles will go into the red category. Next is this vacutainers. Next is about this vacutainers. So the vacutainers, please note the vacutainers without blood. so there should be no blood inside. If there is blood, if there is a vacutainer with the blood, then it will be going into the yellow category. Am I clear? If the vacutainer is with blood, it will go into the yellow category. If it is without blood, it will go into the red category. Are we clear with this? Okay. So Ryle's tube, everything is a red category. Sir, blood tinged gloves also go into red. Yes, beta. Blood tinged gloves, without blood gloves, blood labeled gloves, whatever it is, any type of gloves, all types of gloves will go into the red category. Please note, I would like to give a big shout out over here that it does not include the COVID type of waste. In COVID category, in home quarantines or in home care patients, all the biomedical waste is collected together in a yellow category. This does not, this COVID guidelines is separate. COVID guidelines is separate. COVID guidelines is separate. This does not include the COVID guidelines. It's a general biomedical waste guidelines. All types of gloves will go into the red category. Any doubts you have, you please throw it in the chat box. I will answer it. Pranav says blood bags are yellow bags. Answer is beta yes. In yellow category, you have all these options in yellow category. Can you see that in yellow category, it contains human, animal, anatomical waste. It contains, yellow category contains placenta, fetus. This was your question also, fetus. Soiled waste. Next is the soiled waste. Next is the soiled waste will also go into the yellow category. Soiled waste contains, can you read this? Soiled waste contains plaster, dressings, cotton swabs, face mask, shoe cover, head cap, which are not made of plastic material, are discarded in the red bin if they are of plastic material. So if they are made up of plastic, they are going into the red category. Okay. Discarded linen and beddings. Discarded linen and beddings, they all are in the yellow category. So I'm discussing everything about the yellow category. All the cytotoxic drugs, discarded medicines, everything is in the yellow category. And now you have these microbiological waste. Now you have these microbiological waste, the clinical laboratory biotechnology, including, that is what your question was, Pranav. Medico, can you also see this? I have not made these guidelines. These are there. These are guidelines for us to remember. So sometimes there is a discrepancy sometimes. But these are just the guidelines which are based on some scientific principles. The quality of the blood bag, the material of the blood bag is a recyclable material. It's not a recyclable material because it is containing hazardous stuff, and therefore it is always better to put in, that's how the system is. So these blood bags and blood samples, they all will go into the yellow category. It's not that I have made these guidelines or I might speak unknowingly or I make mistakes. I do make mistakes many times. But over here in biomedical waste, I am very cautious on the words that I speak, and whatever I speak, you can trust on those words, beta. So this is just my simple understanding. My simple message to you is, do not get confused in this. So all the microbiological waste, clinical laboratories, biotechnology waste, including the blood bags and the blood samples and the blood tubes, that is the BT sets also, they all will go into the yellow category. It's about the difference in the material. Okay. So the blood bags are of a different material which somehow are not to be reused because it contains a hazardous material, that is blood. So all the things will go into the yellow category. Okay. Next is, sometimes some people might ask you a question about these fluids also. Please also note that the fluids are of 3 types in the hospital. the fluids will be of three types in the hospital. So the fluids will be of three types. The first is, it could be infected fluids like semen, like it could be any pleural fluid, pleural tap, ascitic tap, sputum, feces, urine, everything is infected fluids. So these are under the yellow category. Next is the silver containing X-ray developing fluid. And third is the disinfectants which are used in the hospitals. Please note, all fluids are in the yellow category. All fluids will go into the yellow category. It contains three types of fluids: the infected fluids, the silver containing fluid, and the disinfectants. All three will go into the yellow category. So please note, all three will go into the yellow category: the silver X-ray film containing fluid, the infectious waste, the fluids, that is the sputum, feces, urine, serum, aspirated blood fluids, everything will go into the yellow category. Liquid chemical waste from laboratory will go into the yellow category. Right? So next is IUCD. So the intrauterine copper devices, they are copper containing devices, but they are all made up of plastics. So they are technically being discarded into the red category, or they can be kept for, like, you can keep it in the red category, but that's how it is. Okay. Yeah, absolutely correct, Ashma. Yes, sir. I remember it is F type fluid, yellow category, F category, fluid category. In the same way, drug category is the yellow D category. Okay. So this is just a small thing for you to remember about the red category. Right? Any doubts you have? Anything you want to ask? Anything you want to ask? Okay. Let's move ahead. Okay. Linen for G type, Gadda type. Yeah, absolutely correct. So let's move ahead. I think you all know about these categories. So just a brief for you. A round for you. What do you think? I will be waiting for your answers. Cytotoxic drugs are discarded in which category? MCQs for you. Cytotoxic drugs are discarded in which category? Broken ampules will be discarded or thrown off in which category? Aspirated blood fluids are discarded in which category? And blood bags and blood transfusion sets will be discarded in which category? So what do you want to write about the cytotoxic drugs? What do you want to write about the cytotoxic drugs? Absolutely right. This is the yellow D category. It goes into the cytotoxic is not yellow D. Cytotoxic is the yellow category. It is a separate bin or a bag which has a yellow C symbol on it. So cytotoxic drugs are yellow category. Broken ampules, absolutely correct, will be discarded into the blue category. Please note that vials which are solid, which are not broken, unopened vials unopened vials which are containing medicines or vaccines, they are in the yellow category. Please note that unopened vials which contain the medicines or vaccines are in yellow category, but if it is a broken ampule or a broken vial, it has to go into the blue category. Right? Next in line we have is the aspirated body fluids. Just now we learnt about the aspirated body fluids. It goes into the yellow F category. Right? Next is blood bags and the blood transfusion sets. Blood bags and the blood transfusion sets. Just now we have learned these are the yellow H category. These are the yellow H category which contains the laboratory waste or the biotechnology waste. They contain the laboratory waste or the biotechnology waste. So I'm going to repeat this point over here again, that the unopened vials or the medicines containing vials which have not been opened till now, they will go into the yellow category. Okay, so what's your question now? Let's see what your answers are. So I think bingo, you've got it right. Many of you are answering it correctly right now. So absolutely correct, beta. Yellow, blue, yellow, 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 blue, yellow, yellow. That was the correct. So everybody going yellow, 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 yellow. So discarded containers of the chemical means. Kaleswar and Murugan has asked a beautiful question that discarded containers of the yellow of the bins of the chemicals mean. So there is a special category in the yellow waste. There is a special category that is for soiled waste, and then there is a solid waste. This is a chemical waste. So in the chemical waste, you can put discarded containers like the containers of the hazardous chemicals like pesticides, rodenticides. So the hazardous chemicals which are not appropriate for human use, they are discarded in a special yellow category. So that is a different type of yellow category. Okay, so yes, for a simple soiled waste, it is yellow C category, but these are special types of yellow categories. Okay, so just remember these special type of yellow category. You don't need to remember A, B, C, D, E, F. So it's actually a yellow E category, but anyways, don't remember. I don't want you to remember to so much. So just remember, beta, discarded container means pesticides and insecticides. They are also discarded in the yellow category. Okay, so any other doubts for biomedical waste? I think there's one area where everybody would love to have a lot of discussion. Okay. So I think any doubts if you have, you're more than welcome to ask. So blue category, just to reinforce, it's all broken glass. It's broken ampules. It's empty vials. But if the vials contain the drugs, they will go into the yellow category. Please mind it. Do not forget, this has not been asked, but it will be asked sometime. Then as metallic body and implants, screws and plates, they all go into the yellow category. If you're talking about the white category, the scalpels, the razor blades, suture needles, needles with syringes with fixed needles, lumbar puncture needles from syringes, everything will go into the blue category. Let's move to the next MCQ. The instrument shown in the diagram is used for. Just 2 MCQs I think remaining, and then we'll switch it off. The instrument shown in the diagram is used for air pressure, air humidity, radiant heat in air, or the cooling power in the air. So what do you think is this? This has to be something like it has to do something with the air. So what do you think is the answer over here? The instrument shown in the diagram is used for unused COVID vaccine. Pranav, yes, they go into the yellow category. The instrument that you see over here is called as a globe thermometer. This is what is a globe thermometer. Globe thermometer is used to find out the radiant heat or the convection heat or the transferred heat. So radiant heat, convection heat, or the transferred heat, they all are going to measured by the globe thermometer. So the best answer over here is unfortunately not air humidity. It is not the cooling power of air. Few students have answered correctly. Nizam Khan, Kaleshwaran Murugan, Arshia Beta. Everybody, you all have answered it correctly. Pranav, yes, that's the correct answer. Radiant heat in air is the correct answer for this. There's a small chart which is available on my Facebook group also. It is there in Marolinks group also. It's there in my Telegram group also. So in many of my posts in my Telegram group on channel, we have MMFC. D stands for the Mukhmohits, that's my name, and the FC stands for the flashcards. So I have these couple of hundreds of flashcards which I keep on posting many times in the Telegram group. So if you have not joined our Telegram group, you are most welcome to join that Telegram group. You get all the updates over there. So these are flashcards which are numbered. So they have a serial number with me. So I just keep on posting them many times. These are the flashcards which I made during my PG time. That's way older time. So just to memorize all the things, I made my flashcards for myself. So that'll be easy for you to remember also, right? So so you can take a note of this. You can take a screenshot and remember for your exam. Hakuna Matata, sir, in which bag should a syringe without needle but containing blood be discarded in? All types of syringes. Please note, beta, that all type of syringes. Where is syringe? Syringe without needles. So all type of syringes. All type of syringes have to go in the red category. Okay. All syringes go into the red category. In case of, ICO stands for in case of. In case of you find blood in syringe, the blood is taken in a separate yellow H category and the syringe has to go in the red category. So you have to take out the blood, put it into a separate container or a separate bin which is like with the containing bloods. So all the blood and blood products, they should be discarded in a yellow category. In case you have a syringe which is there with the blood which you cannot even discard, that whole syringe has to be labeled and blood containing syringe, and it has to be put in a separate laboratory waste category in the yellow category. But technically under the guidelines there is a provision that if the blood is there and the syringe is there, blood has to go in the yellow category, syringe will go into the red category. So that's just a hypothetical situation, I think, which will be there. Otherwise, in simple routine practice, the blood will always go into the yellow category. So blood can be put in a simple vial and it can be discarded in a yellow category. Glass bottles containing sputum. So sputum, that's the same point again. So sputum will be put in special glasses, and the sputum has to be discarded in the yellow F category, and the glass bottle has to be discarded in the blue category. So glass goes into the blue category. So these are just hypothetical situations which we might think which can arise. So anyways, talking about the instrument shown in the diagram is used below. Radiant heat is for the globe thermometer. Let's go on to the next MCQ. Are we okay with this? Just give me a thumbs up if you've understood about the glass, about the syringe without needle but containing blood. So beta, we just have to take out the blood and goes to the yellow category. Okay. Orthotolidine test is used to determine what? Nitrates in water, free residual chlorine in water, free and combined chlorine in water, or ammonia content in water. Please note, what do you think is the best answer over here? Please note that what do you think is the best answer over here? Orthotolidine test is used for. Orthotolidine, thanks so much for giving thumbs up and appreciating that you've understood at least. Otherwise, it's like a one-sided affair. I'll keep on speaking, and on the YouTube, you don't even know that who's listening and who's not able to understand it. Okay. Anyways, coming back to the story, orthotolidine test is used for. Answer is free and combined chlorine. Absolutely correct. You have these two tests. You have a OT test, that is the orthotolidine test. It will tell you about the free residual chlorine and combined residual chlorine. So it will tell you about the both the things at the single time, whereas you have a separate reagent that is called as the orthotolidine arsenate test. This will tell you about the free and the combined residual chlorine separately. So they will tell you about the free and residual chlorine separately. Please note that orthotolidine test is going to tell you about difference between the free residual chlorine and a combined residual chlorine separately. That is what is the orthotolidine test. Another MCQ that you would like to remember is what is the limit for the chlorine level in drinking water. It should always be more than 0.5 parts per million. So chlorine levels in water should be more than 0.5 parts per million. That's a simple question, simple answer, right? So one last question, because there was a request by Kaleswaran Murugan. Sir, can you revise difference between luminous intensity, luminous flux and illumination? Just a very brief question. I already have that in line. Flow, this is the last question. Flow of light or the luminous flux is measured in lumens, lux, luminescence, Lambert. What do you think is the best answer? Flow of light or the luminous flux is measured in. What do you think is the best answer? Flow of light or the luminous flux. So this tells you one thing, that the flow of light is nothing but the luminous flux is given by. So many of you are answering B over here. Muhammad Isha says B, Arshia says B, Nivetha says A, lumens. Nizam says B. So this is pretty important. It's an important 5-star MCQ slide for you. There's a very important 5-star MCQ slide for you. So let us say that there is a candle. Let us say that there is a candle and there is light rays which is emitted. Okay. Or there is a light bulb. There is a light bulb which is emitting light. So now there has to be a flow of light. There has to be a source of light. There has to be a flow of light. Then there is amount which is reaching on a surface. Let us say this is the surface. Let us say that this is the surface. So amount of light which reaches the surface will be there, and then the surface is going to re-emit some light back. It is going to reflect some light back. So this is re-emitting the light. So there are 4 things you need to understand. The first thing you need to know is what is the source. The second thing you need to learn is what is the flow. Third thing you need to learn is how much light is reaching the surface. The fourth thing that you need to know is how much is being reflected again. So there are four things: question 1, question number 2, question number 3, and question number 4. Are we able to understand this? So how much source is there, how much flow is there, how much light reaches the surface, and how much is re-emitted. So these are four things that you need to know. The first thing is how much brightness at the point source. Please remember this. You have to rectify this. You have to embed this in your gray matter, that the source will be given by the luminous intensity. The source is given by the amount of luminous intensity, and it is measured in candle powers. Can you remember this? It is measured in candle powers, or the candela, right? Next is about the flow. The flow is called as luminous flux. The flow is called as luminous flux, and the flux, can you see this? This is the luminous flux, and the flux is measured in a unit called as lumens. It is measured as lumens. So how much lumen will be the flow, how much smooth the light will be. So what lights I have in my room today, one is how bright the light is, second is how is the flow of light. So many times you must have seen those photograph people, they'll have that box type of light, box lights. So the box lights usually have a filter so that they make the light more smoother. So they have a smoother lumens, or that is what is luminous flux, or the flow of light is measured in lumens. Next is how much light is reaching the surface. So reaching the surface, this is what is illumination. Illumination. This is what is illumination, and this is what you're going to measure in lux. This is what is illumination or illuminescence, the amount of light which reaches the surface. So let us say this phone is there. So how much light is going to reach this phone, right? How much light this phone is receiving, that is measured in illumination, and that is what is measured in lux. That is what is measured in lux. So this is one of the very important questions you get, that lux is going to measure what? It will measure the amount of light which reaches the surface. And last is the Lambert. Lambert is how much it's going to reflect back. So how much is going to be reflect back, that is Lambert. It is measured by brightness luminescence, right? So brightness or luminescence, how bright the article will be. You must have learned that, you must have seen somewhere in photographs, there will be a matte photograph and there will be a glossy photograph. So what's the difference between a matte and a glossy? The glossy one is going to reflect more. There will be higher Lamberts with the glossy one, but the matte finish will be lower brightness. It will have a low brightness. The matte finish will have a low brightness or a low Lambert. So are you able to understand this? Was this okay for you? The understanding about the light and what all different values you have. So in case you are able to understand, please give me a thumbs up, so that, or in case you still have some doubt, you're most welcome to ask it. So Kaleshwaran Murugan, did you get this point? That's for you. And these are some of the things which you need to remember for your exam. For this about the light intensity and the luminous flux. So the flow of light or the luminous flux is measured in what? It is measured in lumens. Please note that it will be measured in lumens. This is the best answer over here. Flow of light is measured in lumens, right? So that is the correct answer. Flow of light is measured in lumens, right? So any doubts you have, anything you want to ask, anything which is not clear, anything that is. Thank you so much for all your thumbs up, and thanks a lot for all your doubts and all your queries, and that makes us motivated. So always develop that habit of asking many doubts. If you ask many doubts, you might feel silly, you might look silly, but at the end of the day, you're going to benefit. So this was your session number 5. In the next upcoming session, in the next week, on next Thursday, we're going to meet for talking and discussing about biomedical research. We'll talk about epidemiology, screening of disease, and biostats. So that will be your next session. I would request you all to study in this week about epidemiology, to study in this week about biostats. Gather all your doubts that you can, so that in a single session, rather than me teaching you biostats again, let me give a chance to answer your doubts. So any doubts you have, you're most welcome to ask it. And any doubts you can also ask me in between. So this is what is my area to reach me. In case you have not joined our Telegram group, you should join the Telegram group, because that's where we are discussing most of the times. In case you are a medical doctor and you have not joined the Marolinks group, you're not there on Marolinks, so you can join the Marolinks. Or in case you have not joined the Maro system, then you can join my Facebook group, that is Mukhmohit's Community and Medicine Discussions. On Facebook page and Instagram page is just for reaching me. Any personal messages, you're most welcome to put it over there. Right? So all the very best. Thank you so much for joining in, and wish you all a very happy Republic Day. It was just recently. So have a good night. Take care, and see you all next week. Please note, I'll say it again, that before leaving, please study biostats, epidemiology, screening of disease. If you have doubt, you are welcome to ask me next week. Okay, but only then you will be able to ask if you have studied. So just go on, study. That's the best thing that you can do right now. देखो, ऐश करना, घूमना फिरना, it's very important. But right now, just 1 month before the exam, तो थोड़ा पढ़ लेते हैं ना. That's what we are supposed to do, right? So just make sure that you're doing appropriate work at the appropriate time, because that is going to give you the best results. I'm always pro with this, that ठीक है, पढ़ना भी चाहिए but घूमना भी चाहिए. So you make the best use of all the times. Study hard, play hard, rock it hard, and I know that you're going to excel in your exam. So just study biostats, epidemiology once again, and next week we are going to meet on Thursday at 8 p.m. See you all. Take care and good night. बहुत भूख लगी है. Bye bye.